It's a real pleasure to be here and a real pleasure to have the opportunity to share with you the results of the study that McKinsey and Company conducted along with the input and support from the GS1 healthcare leadership team on the potential benefits of global standards adoption in the healthcare supply chain. All of us, I think, are all too familiar with the headlines that seem to be appearing with increasing frequency about some of the safety issues in the healthcare supply chain. I happened to pick these, but I could have picked headlines that represented any part of the healthcare supply chain, any segment, and also any geography. This demand for increased patient safety is coming at the same time that there's also a clamoring for all of us in the industry to decrease the costs of healthcare. So how do we improve patient safety and also lower the cost of healthcare? How do we do both? In our study, we found that global standards could be one of the keys. In our research, we looked at 3 specific standards. We looked at product identification, product location, and data exchange. And we actually looked at 7 different objectives of how global standards could enable 7 different objectives in the healthcare supply chain. Specifically, we looked at how global standards could support a reduction in medication errors by enabling bedside scanning. And we looked at this for drugs specifically, but the same logic and the same impact could apply looking at device errors and implant errors. We also looked at how global standards can enable improved effectiveness around product recalls. So how could standards enable companies to identify every recalled product unit and identify and remove them more completely and also more efficiently. We looked at how global standards could enable authentication and support for reducing counterfeits, which are an increasing challenge in our global supply chain. And finally, we looked at many different ways in which global standards can enable end-to-end from manufacturer through dispense, kind of inventory and supply chain effectiveness improvement, looking at the improvement of the way that the global healthcare supply chain operates end-to-end and reducing the cost of transactions between different players in the supply chain. As you'll see, these are a mix of objectives around patient safety improvement and cost reduction or efficiency improvement. But what we found is that there's not a trade-off. These are not a trade-off of do one versus the other. In fact, as we looked at each one of these different elements, we saw that they work together and actually support both sets of objectives. So, for example, reducing medication errors not only improves patient safety, but also lowers the cost of healthcare. Improving recall effectiveness improves patient safety, but also reduces the cost if done in the right way and enabled by global standards. So what we found was that there's really a win-win. There's a win-win in terms of our ability to improve the quality and safety of patient care, but we also are able to win for the CFOs of our organizations in terms of delivering cost. So we tried to look at how to quantify this, and what we did was looked at a set of benchmarks, a whole set of analyses. We conducted 80 or more interviews in the industry, and we looked at a whole set of case studies of where individual companies had worked in collaboration, putting standards in place and seeing the impact that it had on their safety and cross-company effectiveness. There are lots and lots of numbers in the report, so let me just highlight a few. What we found was that if you extrapolate the kind of value that companies have been able to achieve through the 7 different objectives that I described before across the global supply chain, global standards could enable $40 to $100 billion in cost reduction in individual companies' P&Ls across the industry. Inventory could be taken down by $60 billion across the industry. But even more exciting is the patient safety impact. So we estimated that 130 million units of recalled products, this is both drugs and devices, stay in the supply chain even after being recalled because our recall effectiveness is not 100%. Global standards could enable a much more comprehensive recall effectiveness and therefore take this number significantly down. If you look at the kind of impact that global standards could have just on the drug side in terms of patient safety through reducing medication errors. We could save 25,000 lives a year. We could prevent 700,000 disabilities. These are huge numbers. They're huge numbers. And obviously, aligning around a global standard is not going to deliver these numbers alone. Companies have to work together in collaboration and put in the kind of processes that are required using global standards to actually deliver these benefits. But the business case is clearly there. Now, one of the questions we asked is, these numbers are huge and very exciting, but do individual companies really have the incentives to invest in global standards? And even more distressing was a question that many posed to us, which is, isn't it true that one part of the supply chain will have to invest only to have the benefits of global standards realized in a different part of the supply chain? So in order to answer this question, what we did was to create kind of a set of imaginary players in the industry, typical players in every part of the value chain. And what we did was to estimate the investment costs that would be required to invest and implement global standards for that imaginary value chain player, and then to look at the kind of benefits that that specific player would reap, assuming that all of its trading partners also were investing in global standards and that they were working together using standards to achieve the 7 different objectives that I described before. And what we found was very striking, was that there is a positive return on investment for every member of the value chain. This is not a zero-sum game in healthcare. Every part of the value chain could benefit if every part of the value chain invests and aligns around data standards. We also looked at what the impact would be if the industry does not align around a single global standard, but instead allows a multitude of standards to proliferate across the global supply chain. We specifically looked at, in the paper, to keep it very simple, what the cost would be of having 2 standards in existence versus 1. And what we found was that there is, in fact, a significant increase in the cost, up to 20% more in terms of the one-time investment required to support 2 standards, as well as up to 10 to 15% in terms of ongoing annual costs of supporting multiple standards. But when we interviewed you and your colleagues and others across the global supply chain, we heard that other elements are even more important than this kind of cost increase. Much higher risk in terms of trying to manage multiple standards and introducing, therefore, the possibility of error as data is translated from one standard to another. Even more important, slower adoption. And we heard this in our interviews very loud and clear, that many companies are saying they can't get alignment around the investment required for standards adoption when there's still uncertainty as to what standard will prevail. So the findings are that if we don't align around one global standard, we will reduce the business case for standards, but also introduce risk and therefore reduce the potential impact to patient safety and slow our adoption as an industry, which of course also puts benefits at risk. We conducted, as I said, more than 80 interviews in the industry. We talked to people in every part of the value chain, so manufacturers, distributors, wholesalers, hospitals, pharmacies, and we talked to people in every geography around the world. What we heard was very, very consistent across the interviews and also very consistent with the findings of our white paper research. What we heard is that people do believe that you all see that global standards will make a difference. What we heard is that you all believe that standards will deliver multifaceted benefits. But we also heard that the only way we can deliver those benefits is if the industry collaborates and aligns to drive adoption. So how can we actually, in this fragmented global industry, how can we actually drive to alignment and adoption? Well, perhaps we can take a cue from the consumer retail industry, which is aligned around GS1 standards and delivered billions of dollars of value over the last 30 years. It's been more than 30 years since the first Wrigley's package of gum had a barcode on it. And the impact of that standards alignment has far exceeded the original business case assessments. We believe the same may be true in healthcare, that the big numbers I showed you may only be the tip of the iceberg in terms of what could be possible in healthcare. Now, in the consumer retail industry, they faced many of the same barriers that we face in healthcare. So how did they overcome them? The key really was having senior business leaders who were connected across different parts of the value chain, so retailers and manufacturers together, really align around not only the technical standards, but also around a vision around the kind of business impact that was going to be achieved. What were the win-win business opportunities that they were going to achieve, and to focus there. The healthcare industry could do the same. So if healthcare senior business leaders aligned across different parts of the value chain, the possibility also exists to create a collaboration and an alignment for adoption and to deliver the benefits that we described. What it would take, though, is a movement away from just a discussion around technical standards, and also not just a discussion around regulatory compliance, but to have senior business leaders really talk about what their collective vision is for improving safety and reducing cost in healthcare. What are the benefits that the end-to-end supply chain wants to deliver in terms of reduced medication errors, or reduced counterfeits, or reduced cost? And senior business leaders would have to actually be quite clear about what they are agreeing to and aligning on around is a timeline for adoption, and also for the metrics to actually track and deliver benefit. They might also want to align around how they work to influence other stakeholders, like regulators, to make sure that the benefits are realized. Let me just summarize with the key messages from our paper so that you don't have to read it tonight. First of all, healthcare is at a crossroads. There is an opportunity, the technology is in place, the GS1 standards exist. There is an opportunity to create alignment and to drive the kind of business value as well as the patient value that we described. Global standards could help to save thousands of lives a year and billions of dollars. Every part of the healthcare value chain could benefit. Multiple standards would diminish the benefits. And finally, senior leaders would have to collaborate to try to achieve the promise that I just described. So what if after this conference there was an inflection in the kind of senior leader collaboration and adoption of global standards that I'm describing? Perhaps then when we reconvene in a couple of years, the headlines might look like this. It's a very exciting vision, a very big vision. And the most exciting part of this vision is that it's the patient, our parents, our children, who would be the beneficiaries. The fact that we would also deliver billions of dollars of cost savings in the industry is a very nice added benefit. Thank you very much.